South Sudan has come out of a protracted, long-standing civil war that has affected its health system and infrastructure. Following the Comprehensive Peace Agreement 2005 and the ending of the war, one of the major priorities of the government remains the need for entire development approach in building up the health system and addressing the health needs of the population, especially women and children. Surveys conducted in 2006 and 2010 across the country have reported baseline social and health indicators. Integral to these poor health indicators is the poor existing health infrastructure and system, shortage of basic health services and shortage of qualified personnel to provide quality health services and to train health care workers.
We want really to train human resource for health, because who will take these messages out there? It is somebody who is trained, and therefore we want to train human resource to deal with health education, to deal with management, and to deal with things like laboratory to detect malaria very fast. Not only malaria, but other things also in the hospitals. We need to train doctors, we need to train nurses, midwives, and so forth. So this is our priority now. And also we would need to improve access to the health facilities. You know, we have a very vast land. South Sudan is almost Uganda, Rwanda, Burundi combined, and therefore we need to improve access to the health facilities. Our population is scattered all over our country, and therefore we need to construct like the 100 facilities that our president wants us to construct. We're running up and down and to construct these facilities, and they will be put in areas where people have never reached health facilities before, so that at least people can now know that their government has come and their government is for them, for their health, for their living, and for their security.
There are two main pillars for health, for any sound healthcare system: human resource and infrastructure. And these are almost infrastructure in South Sudan is almost non-existent. People now talk of reconstruction, but even when you look back before 2000, before 1983, you would find that there has not been much done in the area of infrastructure and health. And so that is one area which is lacking. And then the human resource. Now, the human resource, the importance of it is, if you take maternal health as an example, to reduce maternal mortality, you must have a skill-based attendant. I said earlier we have few numbers in those. So we are concentrating at the moment on producing a skilled human resource. And in that regard, in our 5 training institutions in South Sudan, in Juba and in Maridi, Ye, Lui, and Kajukeji, and now Rumpeg and Wau, we are training midwives and nurses.
While this lack of skilled personnel applies to all healthcare professions, it is particularly worse among medical doctors. The Ministry of Health is currently in the process of strengthening the health system, which has been eroded by the civil war. There is a health policy that focuses on the primary health care as the foremost strategy for health development. The vision of the ministry is healthy and productive population, fully exercising their human potentials.
In place currently as government, we embarked on developing system, policies, strategies for human resource, curriculum, standardized curriculum. We are training the mid-level cadres because majority of our people are in the rural. The mid-level cadres are the clinical officers, the nurses, the midwives, the technicians, like laboratory technicians, who can man the primary health care centers and units. That's where the greater population is.
So far, according to the mapping survey in 2010, there is a total of 14,667 staff that provides health care system in South Sudan, a country with an estimated population of more than 8 million people.
If we look at 10,000 population, that is the size of our Payam or a sub-district. Midwives are only 0.05, not even one midwife per 10,000 population. Similarly, when we talk of a nurse, meanwhile, the standard WHO policy or regulation says 12.5 or 13 nurses per 10,000 population. We can't talk of even one for our whole population of 10,000 population. The doctors should be at least 2 or 3 per 10,000 population. We have less than 1 doctor per 10,000 population, 0.1. So these are the gaps, just as example. And it cuts across if we take all the cadres one by one.
The infant mortality rate in South Sudan is high and reported as 75 per 1,000 live births, while 105 out of every 1,000 children born in the region do not reach their 5th birthday. Children suffer from common diseases in children such as malaria, diarrhea, respiratory diseases, malnutrition-related diseases.
We have conducted so far 2 surveys. One is Sudan Household Survey conducted in 2006. The second survey was conducted in 2010. Both surveys, they give us critical information in terms of the child health. Infant mortality is among the highest, perhaps in the whole world. The available information tells us that 75 out of 1,000 live births, children in South Sudan, they died before they celebrate their 1st birthdays. 102, they died before they celebrate their 5th birthdays. And these children, they die because of the infectious disease that could be prevented. They die because of malaria, they die because of pneumonia, they die because of the diarrheal disease and other infectious disease that could be prevented.
The nutrition status level in South Sudan is high, and this poses some of the health problem in the region, with children under 5 are more likely to be underweight, stunted or wasted. This is true of the recent household shows that in 7 out of the 10 states. Maternal mortality in South Sudan has been reported as 2,054 or 10,000 live births, the highest reflected not only in sub-Saharan countries but in the world. But reproductive health remains a real challenge, with only about 26.2% of the pregnant women having received antenatal care by skillful health personnel, while delivery attended by the skillful health personnel is 10.02% only, and deliveries at the health care facility are reported at 13.6%.